sadly, according to the Centers for Disease Control, some 700 women die in the United States every year because of complications due to pregnancy or childbirth. And we're going to talk about that today with Dr. Karen Cassidy, who has been a regular on the program. Nice to see you again.
Thanks for having me.
I know that there was a recent study that came out from Health Grades, is it, and the United Health Foundation on the health of women and children in this country. What did it reveal?
So when we look at the American Health Rankings and what they showed around maternal and child health, we do see a significant disparity between black women and white women across the country, but also specifically in Tennessee, where black women are dying in that postpartum period at 3 to 4 times the rate of white women. So it's a really striking and concerning disparity that we're seeing between the two populations.
In 2018, that just seems really hard to believe. What do you attribute that very sad number to?
Yeah, so there actually has been quite a bit of research. It's all pretty early because this has been newly identified, but lots of people are looking into it. And one of the interesting things is it's not related to socioeconomic status or education or even the amount of health care you receive during your pregnancy. It really seems to be a unique issue related to being a black woman in the United States, and people are thinking this is related to systemic racism and the chronic stress that's caused related to that. People are referring to something called weathering, that chronic stress over time and the toll it takes on people physically.
Because we do know that there are many things that a woman can do even before conception to stay healthy and to, maybe it doesn't ensure, but it certainly can contribute to a healthier pregnancy.
And we strongly encourage that for all women. So, and you know, United has some great programs in place that really support women. We have about 160,000 births for our TennCare population that we support here in Tennessee. And we have a healthy pregnancy program, healthy first steps program, baby blocks program that really look at trying to engage women, all women, in good prenatal care, and then making sure that their infant goes on to have those visits that they need in that first year of life to ensure that they're healthy. But those are really targeting the things that we've always targeted. So good prenatal care, prenatal vitamins, making sure you're eating healthy, not smoking, all the normal things that we encourage moms to do. This disparity really seems to be a unique risk factor for black women.
So certainly there are programs or ways of reaching the community you're after.
So we're really looking at that right now. So do we need support groups or doulas or other ways of addressing this, or just honestly backing up and looking in general at kind of how we educate and treat women from the time they're very young growing up, particularly minority women, how we support them.
So you're saying it's not lack of accessibility?
No.
Because you oftentimes
even a very educated black woman who is doing all the right things has a higher risk of death in the postpartum period. And we're really trying to wrap our resources and our collective healthcare mind around what to do to help that population. How do we make that better?
Okay, for whomever's watching the program right now, what are some tips that you can give women of all races to give them a better outcome?
So we tell every woman a planned pregnancy is best. If you find yourself pregnant, get yourself in quickly to have prenatal care. You want to make sure you're engaged with an OB, that you're taking good care of yourself, taking that prenatal vitamin, making sure you're not smoking or drinking during your pregnancy. I think that good overall nutrition, sleeping well, all those things we do for good self-care are really important, particularly when you're pregnant. And then making sure you're engaging with a pediatrician after your baby's born. If you have barriers to care or you're not sure what is appropriate, there are programs out there. So there's a supportive pregnancy program that all women in the state of Tennessee can access. It was actually a partnership between the March of Dimes, United Healthcare, and the Tennessee Health Department. It's a website you can access. It has supports and things. And then for United members, there's specific programs both for our commercial population. There's a healthy baby program, or healthy pregnancy, program. And then for our TennCare or our Medicaid population, the baby blocks program for babies, for infants, and the Healthy Starts program would be the one for pregnant women to track them through their pregnancy and then transition them to that healthy or that baby blocks program after the baby's born.
Now, talk about the stress, which you've referred to several times, in terms of managing the stress. What would be
Yeah.
some exercises, things
Well, I
that
mean, I
the
think
women can
anything
do?
you can do to manage stress is helpful. So whether that's sleeping well or yoga or exercise or having a support group, that's all things that are helpful. Anything that we can do to support women to have good self-care and good stress management is helpful.
Is there anyone you can go to, any other organization that has dealt with this, maybe in other parts of the country, that could lend
So
some
the
support?
CDC is really actively looking at this issue. Obviously the professional societies for OBGYN are actively looking at this issue. And also I think all of whether you're an insurance company or healthcare provider, this is something very actively on everyone's mind, and people are coming together to have a bigger conversation about it. So I think there will be more to come on kind of how best to proceed and address this. But I think for now what we know is we want women to do everything they can to manage stress and do all those things they know they need to do as far as accessing care for a healthy pregnancy. I think, and the reason I'm kind of stressing that we don't really have a fix to address this, I want to be really careful that we don't say, if you do this, this problem goes away. Because I don't think we can say that right now, and I don't want to give a false impression that women who are dying at a higher rate postpartum aren't doing something they should be doing in their pregnancy. Because I think even when they are doing all the right things in their pregnancy, we're seeing higher death rates in that population.
So frustrating.
It's a terrible problem that we really have got to work hard to figure out.
Thank you so much for coming on, Dr.
Yeah, thank you
Cassidy.
so much for having
Appreciate it.
me.
All right. And we'll be back with a lot more right after this.